All right. Is my voice audible? Everyone, just give me a thumbs up if yes. All right. So today we will be starting neuro. We'll be dividing it into two parts, part one and part two. Part one, I'll try to finish it to today till movement disorders. Okay. Till then, we'll finish neurophysio, neuroanat, and some parts of pathology, and remaining from movement disorders, pharmacology, ear, eye, everything I'll finish tomorrow. Okay. So this is very high yield system, very high yield system, and it is one of the easiest system. Okay. Once you are thorough with the cranial nerves and everything, this system is very easy because uh, once you will know कि actually किसमें क्या हो रहा है, what part of region is causing what symptoms, then you are good to go with this system. Okay. Yes, I have shared some images over here with from Melman medical material. So there are just some images and some important points that you need to know. So we will discuss everything today. So let's just start. All right. So neurology and spatial sciences, first page. Let's just start. Starting from the embryology. See, they haven't asked any question regarding the embryology. Okay. So just let's see what it they are trying to say. Notochord induces overlying ectoderm to differentiate into neuroectoderm and form neural plate. Okay. And what else is, yeah, alar plate is dorsal, basal plate is ventral. And one more thing is they will give you sometimes ki during the embryology, most common default gene. I mean defaultive gene, not defaultive. You can use defective gene. Okay, they will give you this line, and sometimes you will be confused with so many options over there. So what you can do is you can always go for S double H gene. Okay, always go for S double H gene because Sonic Hedgehog gene, the full form is, okay, this is the full form. You can always go, they have already given you Sonic Hedgehog, so always you can go for this. If you are not able to understand, if they have specifically mentioned some features, then you need to think about it. Okay, just give me a minute. All right. Okay, so that's all for this neural development. Yeah, but now coming to the regionalization of neural tube, this part is very important. Okay, now how it is important is they won't directly give you this image and ask you ki kaun sa region hai, what region is this, what region is that. Okay, they're not going to ask you that. What they will do is they will try to give you a disorder in any one of those this, regions. They will try to give you disorder. Okay, after at the end of a question you will be asked the disorder, the pathology involved in this region is derived from what part during the embryology. Okay, this is how they are going to play with you. So you have to remember each and everything, this part also and this part also. I'm repeating, I'll write a question here, how they are going to present to you. They will give you 10 line case plus at the end you will be asked to diagnose, plus after you have made the diagnosis in your mind, you will be asked the pathology occurs in a particular region, and the final question that they want to ask is uh, from which part of brain during embryology, or you can say embryogenesis, anything, this region was developed. Okay, so this is how they are going to play with you. They will ask you 10 liner case. At the end, you will be making diagnosis on your own, and then they will ask कि ये जो region में diagnose हुआ है, okay, the pathology that is occurring in this region, from where that it was developed, or from where it was differentiated. It was forebrain, midbrain, hindbrain. Instead of forebrain, midbrain, they might give you telencephalon, diencephalon. So you have to select which one. Okay, but they won't confuse you with one thing. If they say forebrain, they won't give you two options: telencephalon, diencephalon. Okay, but since they have given here arrow, you should be knowing that. If your luck is bad, they will ask you. Okay. Okay, Sharon Siraj is saying she can't see the FA screen. Srusti, my screen is visible, right?
Yes.
Okay, Sharon, you can leave the meeting and come back again. Maybe there is some network error from your side. Okay, so let's just continue. Central and peripheral nervous system, neural crest, PNS, and CNS. This is all the basic stuff. But do remember this thing. So many questions have been asked in UL, and even NBME has asked. Sharon, is it okay now? Are you able to see the screen?
Yes, I can. Thank you.
Okay, no worries. Okay, so regionalization of neural tube, mark it as very high yield. All right, moving ahead. Note down this question if you want to, because definitely this is going to come, and this is seems very easy, but when you look at these locations and try to remember, it becomes difficult. Not only this, even this part. Okay, about the cavities also they asked. All right, moving ahead. Neural tube defects. Okay, this is not very high yield, but you can give it as an important because one or two questions may be asked. And so let's just see what is actually happening here. Neuropores fail to fuse by the fourth week of development. This line is very important because in NBME, one of the question was there. They gave you the description of any one of the disease, and they gave the lab values. So in your mind, you were sure it is they are talking about some neural tube defect. Okay, but after this, what they gave is they gave you what was the pathophysiology behind this. Okay, the pathophysiology is this: neuropores fail to fuse by the fourth week of development. Okay, fail to fuse. So instead of this, they will use fusion of neuropores. ओके, ऐसे भी ट्विस्ट करके आ सकता है, फेलियर ऑफ fusion of neuropores. So you should not be confused because this small things is what going to confuse you. Okay, so let's just see what is happening over here. It occurs with diabetes and folate deficiency during pregnancy. This is the lab value: alpha fetoprotein increase in amniotic fluid and acetylcholinesterase. Now one thing you need to take care: it is normal in spina bifida occulta. AFP is normal in spina bifida occulta. Okay, so AFP increase होना ही चाहिए, जरूरी नहीं है. Can anyone tell me where else this AFP is increased? Anyone? Srishti, Sharin, can you tell me any one of you?
Prostate.
हाँ, where?
Prostate, I guess. 1 second.
One of the most common tumors. You have done this. Come on, quickly tell me quickly. AFP is a tumor marker. I need to know this. You should know this. Ever heard about hepatocellular carcinoma? AFP, alpha fetoprotein. याद आया? सुष्टि याद आया?
Yeah, right.
Okay. Hepatocellular carcinoma may be AFP is very important. Okay. So here also AFP is important. So when you read the term AFP, first two things should be neural tube defect and hepatocellular carcinoma. इसके अलावा you have many things in the reproductive part. Okay. So you can skip that. But these two are very important. Most commonly AFP hepatocellular carcinoma के साथ relate होगा. Okay. So don't confuse it. Keep this in mind. Coming to spina bifida occulta, failure of caudal neuropore to close. And if we go to anencephaly, it is failure of rostral neuropore to close. This is important. Again, one liner. Caudal neuropore to close and failure of rostral neuropore to close. This is important. Okay. Coming to spina bifida occulta, no herniation. Usually seen at the lower vertebral level, not important. Not yeah, this is important. Associated with a tuft of hair or skin dimple at a level of bony defect. Okay, so there will be tuft of hair, no nervous system, no meninges, nothing will be there. Okay, so clear cut होगा. Okay, so the diagnosis कैसे आएगा? How they will ask for the diagnosis? They will say increase in AFP, increase in ACH, and then they will give you there was a protrusion coming out from the umbilical region, and there the tuft of hair was seen under the test. Okay, there were no neural structure found. So this is how the spina bifida occulta will be presented to you. Okay, coming to anencephaly, no forebrain, open calvarium. Clinical finding polyhydramnios. So in the image they will show you in the exam they will show you you know a dead fetal tissue. You can see a dead baby also, but there will be no closing about the on the skull. No closing on skull. Okay, it is a very common image anencephalica, the one that is given in your UL. That only you can expect it in NBME. In the recent NBME, I don't think anencephaly was asked, but in the old NBME, there was this image. Okay, the baby will be completely red and ऊपर का नहीं होगा, direct आँख से उसका body start होगा. The body will be starting from its eyes. Okay, so think about this anencephaly. Coming to meningocele, meninges but no neural tissue. Meninges but no neural tissue. Myelomeningocele, meninges and neural tissue. Okay, meninges and neural tissue. This is how you will be distinguishing. All right. Myelosclerosis, they never ask. So you can avoid this. Confuse nahi karna hai, avoid unnecessary information. So these are the four defects that you need to remember. Common thing you need to remember here is neuropores fail to fuse by the fourth week. This is one point. Second point is AFP increase, ACH increase. Third point, spina bifida occulta mein AFP normal. Okay. Coming to spina bifida occulta, it is a failure of caudal neuropore and anencephaly failure of rostral neuropore. Okay. Meningocele में only meninges. Myelomeningocele में meninges plus neural tissue. Spina bifida occulta में no meninges, no neural tissue, only tuft of hair. Okay, so I think this is clear. Neural tube defect is clear. AFP याद रखना hepatocellular carcinoma में one of the most important tumor marker. Okay, now brain malformation. Lissencephaly did never ask. One question was there in I think you will, but apart from that, I haven't seen that anywhere. Holoprosencephaly most commonly asked. So let's just discuss this. Failure of forebrain to divide into two cerebral hemispheres. Okay, the developmental defects usually occurring at week 3 to 4, associated with H-double-H mutation, may be seen in Patau syndrome. Patau syndrome, trisomy 30. We discussed this in biochemistry. Okay, present with the midline defect, monoventricle. There will be no midline. Okay, and this image is very commonly given. It can be associated with cleft lip, cyclopia, proboscis, increased risk of pituitary dysfunction. So, okay, you can avoid all this. Okay, the most commonly how they are asking the question is they will give you this line, midline defect and monoventricle, and the third point that you need to remember here is H double H mutation. Okay, holoprosencephaly का definition है failure of forebrain to divide into two cerebral hemisphere. ये उसका definition है. Okay, this image is very commonly asked. As soon as you see this image, think about holoprosencephaly. Now, sometimes if they don't want to make the question related to neurology over here, they will relate it to the biochemistry. Okay, and your answer is going to be Patau syndrome as given here. Patau syndrome. Okay, so you have to interlink each and every system, each and every subject, and then apply the question. Okay, they will give you everything. At the end, they will give you this is associated with Patau syndrome, Edwards syndrome, Down syndrome, or any other syndrome. Okay, so make sure you know this. Listen carefully. Just remember this. In the UL, they have asked this failure of neuronal migration. So microcephaly के साथ associated होता है. Okay, this was asked in UL. Only one question. इसके अलावा I have never seen this question anywhere else. Okay, focus on holoprosencephaly. So this page is done. Neural tube defect, clear it yourself, and holoprosencephaly. Remember this image and two lines. Moving ahead, posterior fossa malformation. One or two questions are there in UL, but in NBME, the questions were not specifically asked on this. Questions were asked on many congenital disorders, but options used to pop up. Okay, in the options ये नाम आए थे. So if options are there, you need to be thorough with what do you mean by that option. Okay, that's all the NBME is working for you. Now let's just see KRE1 malformation में क्या होगा? Ectopia of cerebellar tonsil. Okay, and what is there in CRE2? Herniation of cerebellum and medulla, vermis and tonsil. Okay, now how they will be presented to you is in childhood, adulthood with headaches and cerebellar symptoms. Cerebellar symptoms means balance nahi hoga. There won't be balance. The child won't be able to stand properly. He won't be able to walk and stand while closing his eyes. We will discuss everything in cerebral. Okay. And यहाँ पे क्या होगा? If they want to ask GRE2 malformation, they will give you hydrocephalus. Okay, hydrocephalus we will be discussing soon. So just you have to figure it out. Another thing is they will give you myelomeningocele here and they will give you syringomelia here. Okay, so these three are the differences how you can identify CRE1 and CRE2, and along with this X-ray, MRI are very important. Okay, MRI देख के you should be knowing what is happening. Okay, neuro में 50% questions will be solved if your radiology knowledge is good. Okay, it can be CT, it can be MRI. 50%. If you just look at the image and if you are able to think, yeah, I know the answer, no need to look at the question. Okay, so जितने ज्यादा images देखोगे उतना अच्छा होगा. And Melman Medical, this is the resource. Melman Medical, yeah. Here, what mistake do people make is they go for neurology instead of neuroanatomy. Okay, I have seen many people, they have done neurology, but they haven't done neuroanatomy. Whereas for this step one, neuroanatomy will be playing more role than neurology. Okay, you can expect at least three questions in each and every block in the exam. So in total, 20 to 25 questions you can expect from neuro itself. Okay, so just do this properly because this is very high yield. And another thing is this is the easiest system. Just look at the MRI and CT. It is very big. That's why you feel it is very difficult. Okay, this is the easiest one. Dandy Walker, never ask, ignore. Syringomyelia, we will do this in the spinal cord syndrome. But one thing I want you to know over here is, okay, just look what I'm saying. If in the exam they give you a spinal cord structure, okay, they will say this spinal cord structure was seen on MRI. Okay, so let's just make it whole black. Okay, let's just make it whole black. And this is most commonly asked, and sometimes we become confused what we need to do. So let's just make it whole black first. Okay, ये पूरा black कर दिया. Now, one common image that they give for syringomyelia is this is what your X-ray, sorry, MRI will look when you are looking out for syringomyelia. A white spot, dark white spot in the center of the spinal cord. Okay, this is where the problem is occurring, and as a result of this, syringomyelia is occurring. Okay, now important point here you need to remember is loss of pain and temperature, afferent lateral spinothalamic tract. These 2 points are very important. And what are these? We will be doing this in the spinal cord section. Okay. For now, just remember this image very frequently asked. If you don't understand the question, just look at the image. If it is given something like this, go for syringomyelia. Okay. And as we know, syringomyelia is associated with KRE1 malformation. We have studied. So for syringomyelia, they can ask in the question what other congenital condition can be associated here. Okay, so make sure KRE1 syringomyelia. Yeah. All right. Moving ahead, tongue development. Tongue development is not that high yield, but most frequently they like to ask one or two questions. In the UL, so many are there. Okay. In the NBME, one, two are there, but I don't think in the exam they will be asking this. Let's just see what they are trying to say over here. Okay. First pharyngeal arch forms the anterior two-third of tongue. So sensation via third branch of trigeminal and taste via seventh nerve. That is facial nerve. Yeah. Third and fourth pharyngeal arches form the posterior one-third of a tongue. Sensation and taste mainly via 9, extreme posterior 10. So what they will ask is they will be asking you about taste in different regions of tongue. It can be anterior, it can be posterior. Now one thing, if they say posterior, your answer will be 9. But if they say uh, near the pharynx or at the end, then your answer will be 10. Okay. So if it is anterior, it is going through spatial nerve, seventh nerve. Okay. But if it is posterior, your answer will be glossopharyngeal nerve. And even the back of that it is going, it will be vagus nerve. Okay. So you need to keep this in mind. Another important thing in neurology is they frequently ask about the pharyngeal arch, aortic arch. So they will ask you over here the first pharyngeal arch formed which part of the tongue, third and fourth which part of the tongue, or what part of tongue is formed by which part of the pharyngeal arch. Okay, mark my word, they won't ask directly. They won't ask directly. Okay, they will confuse you and then they will ask. Okay, so you should be clear with your facts. Now coming to the muscular supply, the motor supply, it is by CN12, that is hypoglossal nerve. Everyone knows this. Okay, these are the muscles. In UL, they have asked the functions of muscles also. If you have solved properly, you must be coming across this question. They have asked the functions of muscle. So hyoglossus ka muscle function is retracts and depress. Genioglossus ka protrude. Styloglossus ka sides of to create a trough for swallowing. Okay. Now one thing is here. Palatoglossus is not supplied by 12. It is supplied by 10. And this is important over here. Very important. Okay. So this is what they have given about the summary. You can keep this in mind. Three concepts that you need to remember here is first pharyngeal arch forms the anterior में taste is by facial nerve. Third and fourth forms the posterior में taste is by 9 and 10. Upper posterior is by 10. Okay. Now four muscles of tongue. Palatoglossus is the only one that is not supplied by 12. It is supplied by 10. Okay, and just try to remember the functions of this muscle. Very rare chance they will be asked, but you should be knowing in case if they ask. Okay, so we are done with the tongue, we are done with the embryology part. Now moving on to the anatomy and physiology percent case of the neurology. So see, these are, I'm not going into detail over here. One thing I want you to focus here is astrocytes. You will have one big question for you. Okay, so astrocytes are very important, and let's just see what is important over here. Important over here is in the UL, they gave you the most common type of cells or the most frequent cells or the most cells in numbers. They give you a case and then they ask you this. Okay. And the second type of question is research question. As I am discussing always, research question. So research questions are what they will say. A scientist, he was performing a research or researcher performing a research and then uh, he found out a type of cell that is responsible for carrying out these functions. Okay, so research questions are like this. So now what they will say is most common glial cell type we know already. So they will ask you for the function. Okay, so let's just see: physical support, repair, removal of excess neurotransmitter, component of blood-brain barrier, glycogen fuel reserve, very important. Okay, in UL one question is there. Okay, there are five options, and in each of the options they mention the functions of astrocyte. Okay, so you have to pick out which of the following combination was correct. Okay, sometimes they gave you the functions of microglia, sometimes they give you the functions of ependymo cells. Okay, ependymoma cells or oligodendrocytes, something like that. Okay, so you should be thorough with the astrocyte function, very important. And astrocyte marker is GFAP. Where it will be reused? It will be used when you study the brain tumors. Okay, so astrocyte I mark as very high. Microglia are the phagocytic cells. It means they are macrophages. Ependymal cells, they are responsible for CSF absorption and production. Moving ahead, myelin. Myelin in CNS is maintained by oligodendrocytes, whereas in PNS it is maintained by Schwann cells. Okay. One important point in myelin is increase in conduction velocity of signal transmitted down axon, saltatory conduction of action potential at the nodes of Renvier. Okay. Now this question was asked in UL. Two questions were asked in UL. What was that? First, what is saltatory conduction of myelin sheath? Okay. So saltatory conduction is increase in conduction velocity of signal. Or in the UL, they ask is what is the phenomenon for increase in conduction of signals in myelin sheath. Okay, so saltatory conduction of action potential is very important. Okay, now where does this saltatory conduction occur? Nodes of Ranvier. And what is present at the nodes of Ranvier? High concentrations of sodium channels. Very, very high yield information. They will focus on the basics in step one, and this is one of the basics that I want you to remember. Okay, one important point, UL has this, and NBME didn't ask any question related to this, but I got it in exam. Okay, so I want you to remember myelin wraps and insulate axon, decrease in membrane capacitance, increase in membrane resistance, increase in space constant, and decrease in time constant. These two questions are there in UL regarding this. NBME ने एक भी नहीं पूछा, but in exam I got this question. This is not mentioned in the old edition of first aid, but it is mentioned in the new edition. So if you are using old edition, please make sure you note this. UL करते वक्त गलत नहीं होना चाहिए if you haven't solved this part. Okay. In UL, they will be focusing on the space constant and time constant. Okay, so in exam also I got this question, so this becomes very high yield. NBME hasn't asked, UL has asked two questions, so make sure you know this very properly. All right, let's move ahead. Squam cells and oligodendrocytes. Squam cells are responsible for myelin sheath formation in PNS and oligodendrocytes in CNS. Oligodendrocytes lead to multiple sclerosis. Squam cells lead to Guillain-Barré syndrome. Okay, so we will discuss this everything in detail later. Nothing else you need to remember here. Neuron action potential, avoid it. No need to do. It is just the basic action potential that you are studying in physiology for cardiac, neuro, everything is same. Depolarization by sodium, depolarization by potassium. That's it. Okay, nothing else. So you can avoid this. Sensory receptors, UL has one question, NBME had no question. Okay, but UL has, so you have to do. Free nerve endings, A delta is fast, C is slow. Okay, these are myelinated and unmyelinated. If they are unmyelinated, it's going to be slow because there won't be solitary conduction present over here. Now here one thing you have to remember very much is Meissner corpuscles, Pacinian corpuscles, Merkel dish. These two they have never been asked in UL, but if your luck is bad, exam might ask you. So what do you need to do over here is this is same for this. Okay. Now in the question they will give you what is the location. They will give you what is the location, but you will have to figure out what the problem will occur if there is a problem in any one of them. Okay, so you will may I think one question is only there, but they might ask. Okay, because it is information and they want to confuse you with information, so I want you to remember this. Okay, just these three you can avoid this all. Okay, ये तो आपको याद हो ही जाएगा. A delta plane is fast but a taxi is slow. Just remember this. And इसके अलावा कुछ आता है. If anything else is asked apart from this, think about Ruffinic opposite. Okay, so make sure at least ये तीन तो आप कर ही लो. All right, moving ahead. Sherin, you are able to understand Hindi, right? When in the between when I speak Hindi, you are able to understand, right?
Yeah, yeah, I know Hindi. Yeah, yeah, it's fine.
Okay, okay, no worries. If you have any doubt, you can mention in the comment section. I will look to it in the middle, in the between, or after the class. Okay, and if you want to discuss it with me, raise your hand. I'll ask you to on your mic and speak. Okay. All right. So again, epineurum and perineurium surround the fascicle of nerve fibers, and this is then never asked. One question was there in UL, but this is very basic. I hope you might be knowing this. Okay, just remember what is endoneurium, perineurium, and epineurium. Nothing else. One important point when we'll be studying GBS, that is Guillain-Barré syndrome. Guillain-Barré syndrome may there is a problem in the endoneurium. Okay, just remember this small thing. Okay, coming to chromatolysis, asked in NBME, asked in UL. Okay, so how to remember this is Wallerian degeneration. Just remember the image. Same image will be given in the exam also. Okay, now remember one thing. Wallerian degeneration occurs at the distal end of a neuron. Okay. Chromatolysis occurs in the proximal. Okay. So this is what you will remember over here. If it is proximal, they will mention you in the question. It is the injury in the proximal or injury in the distal part. Okay. So if it is in the proximal, you need to remember these three features. High yield. And if it is distal, they will directly give you Wallerian degeneration. Directly one word. Okay, now let's just see what does Wallerian degeneration means. Disintegration of axon and myelin sheath distal to the site of axonal injury with macrophages removing the debris. Okay, simple है. Proximal में you can see the three things that are found. Alright, so this is what you have to remember here in chromatolysis, nothing else. Moving ahead, neurotransmitter changes with disease, and for now you just forget what are the changes in disease. For now, just forget. Okay, this we will do along with the disease. What you need to remember here is the location. They have directly asked. Okay, they will how they will ask is the neurotransmitter that is responsible for this condition is synthesized where. Okay, this is the typical question, and so many questions in exam also. I got 2 3 questions in NBME also. It is there in UWorld also. It is there. So you have to remember the location. You have to remember the neurotransmitter. Okay. See, neuro is all about remembering. I can't help you with remembering part. Okay, I can just tell you what you need to remember, what you not need to remember. So yeah, remember the location of synthesis. You will be confused between Raphel nuclei and basal nuclei of magnet. You will be confused. Okay, so they won't directly ask. You have to figure out what is the neurotransmitter deficiency here, or what is the neurotransmitter excess here, and then based on that, you will be picking out where the location is. All right, moving ahead. Meninges, ignore for now, no need to know. Blood-brain barrier, 2 points are there. Glucose and amino acid cross slowly by carrier-mediated transport system. Non-polar lipid-soluble substance cross rapidly via diffusion. This is high yield. Okay. Another thing, prevent circulating blood substances, drug, bacteria from reaching the CSF or CNS. This is important. Another point, and what is important? Yeah, area prostema, vomiting after chemotherapy, OVLT, or neurosecretory product to enter circulation. So why this is important is because sometimes in the exam they will ask you the vomiting centers after chemotherapy. Okay, so you need to remember area prostema, OVLT, neuro, at these 2 points. Okay, so this is important. And yeah, another point you need to remember here is if there is a disruption of blood-brain barrier, there will be vasogenic edema. So for this, in order to lower down the pressure, you will be giving hyperosmolar, that is mannitol. Okay, so this is very important, and yeah, these 3 points are very important. All right, moving to vomiting center, as I told you, what they will ask is, so just remember, let's just look it down. They won't ask, this is not high yield, but in UWorld they have asked. Okay, it's not high yield. In NBME I haven't found a question, so let's just see. Coordinated by nuclear tractus solitarius in medulla. Okay, ignore this. Let's start with the centers. CTZ, that is chemo. Okay, we'll do everything. Which receives the information from the chemoreceptor trigger zone, CTZ, located within area prostema. Okay, so area prostema is very important. We have discussed in the BBB. GI tract via vagus nerve, vestibular system, and CNS. So CTZ and adjacent vomiting center nuclei receive input to the 5 major receptors: histamine, muscarinic, neurokinin, dopamine, and serotonin. So these are the 5 major receptors that you have to remember. Second thing that you need to remember is chemoreceptor trigger zone. Where is this located? In the area prostema. So these 3 points are very high yield, and these are the treatment for the vomiting. So most common treatment that you need to remember is serotonin receptor antagonist, chatron drug. Okay, so this is just the normal information, basic information. Just remember the 3 point: chemoreceptor trigger zone, where area prostema, and what are the uh, substances that are responsible for causing that are responsible for transmitting the signals to the vomiting centers. So these are the five substances that you need to remember. Okay, sleep physiology, very important. Now, what they will ask is over here, they will ask you whether it is REM or non-REM, and if it is non-REM, what is the stage? They really ask this. Okay, so how you will be diagnosing which type of it is? Remembering the waves. Okay, remembering the waves. Now, one thing you need to remember is for beta wave, you have high frequency and low amplitude. Okay, but for delta wave, you have low frequency and high amplitude. Okay, second thing, they have asked in which case spindles and K complexes are formed. Okay, they have literally asked. Okay, now coming to the symptoms, how they will be asked based on the symptoms? They will say tooth grinding. In which phase tooth grinding occurs? N2. Which is the deepest non-REM sleep phase? N3. Sleepwalking, night terrors, and bedwetting occurs in which phase? N3. Okay. Now, what is the difference in the REM? So, increase in oxygen use, nightmares, penile or clitoral tumescence may occur. So, what is this? Is there will be erection. Okay. Nocturnal erections occur in the REM sleep. Okay. And another thing is occurs every 90 minutes. Duration is increased throughout the night. So, see, what you need to remember here is you have to remember कि कौन से फेज में कौन से फीचर्स दिख रहे हैं. Okay, this is one point. Second point is कौन से फेज में कौन सी waves दिख रही है. Okay, and sometimes they won't directly say you कि this wave is seen or that wave is seen. For example, if I want to make a question of N2, they will say sleep spindles and K complexes are seen in EEG. Simple ये line दे देंगे and you need to know spindles and K complex, it is there in N2. Okay, so this is how you will be giving the question. Another point, another high yield point here is they will ask you the changes in the sleep cycle in older patients. Okay, and changes in sleep cycle in MDD patients. MDD is major depressive disorder. Okay, so these are the parameters you need to remember. NBME ने पूछे हैं and even you will as asked. Okay, so guys, lots of information to remember in neuro. And I know that is why it is becoming difficult, but once you go through and solve questions daily, you are going to go. Okay, so this is about the sleep physiology. Only question they will be asking you REM ये दोनों का. Okay, N1 N2 N3 need to remember. N1 तो आपको याद भी नहीं करना है, तो just N2 N3 in REM. Alright, and these two, please, these parameters are very important, don't forget it. Moving ahead, hypothalamus. Now coming to the easiest part, hypothalamus and thalamus. Just one word you have to remember. Yeah, let's just quickly finish this. Yeah, lateral nucleus आया, so it is about hunger. Ventromedial, it is satiety. Okay, so how the question will be asked? I hope you are clear with that. If lateral nucleus is damaged, so hunger वाला damage हो जाएगा. Okay, it means every time you won't be able to eat, you won't feel like eating. Okay, in spite of not eating since last 3 to 4 days, your stomach will be full because the brain won't be able to stimulate the stomach कि यार खाना है तुझे. Okay, so lateral nucleus, ventromedial nucleus is for satiety. Ventromedial nucleus में injury हुई, so you will be obese, you will be keep on eating. Okay, so questions will be framed to you like this. Okay, he keeps on eating continuously, he hasn't eaten from last 3 to 4 days. Where is the defect in the brain? ओके, सो आंसर में ऑप्शन में आपको रहेगा लैटरल वेंट्रोमीडियल, सिंपल है. ओके, कमिंग टू एंटीरियर न्यूक्लियस, कूलिंग. कोस्टियल न्यूक्लियस, हीटिंग. सुप्राकायस्मेटिक, सर्कैडियन रिदम. ओके, सुप्रा ऑप्टिक एंड पैरावेंट्रिकुलर, एडीएच एंड ऑक्सीटोसिन. या एडीएच एंड ऑक्सीटोसिन है, बट याद रखना ADH by supraoptic, oxytocin by paraventricular. It is respectively. Okay, they always forget to remember. Sorry, always forget to act respectively. All right. And pre-optic not frequently asked, तो ये avoid कर दो. बाकी one word याद रखना. Okay, just one word. Hunger है lateral nucleus, satiety ventromedial, सर्काडियम के लिए suprachiasmatic, cooling के लिए anterior, heating के लिए posterior, and ADH and oxytocin you know from the endocrine only. Okay, so just remember this function, and in the question if they say disorder is there in this function, remember what is the lesion in the brain. Okay, sometimes they won't give you any of this lesion, so आप hypothalamus select करोगे. Okay, it's common sense. All right, moving ahead, coming to thalamus. Thalamus may be same, कुछ ज्यादा दिमाग नहीं लगाना है. All right, let's just see. The most easily and the most commonly asked is lateral geniculate nucleus and medial geniculate nucleus. Okay, how to remember? Lateral light, light है तो vision, medial M music तो hearing. ये दो हो गया आपका काम, तो ये दो को हटा दो. Now coming to ventroposterolateral nucleus, this is the commonly asked. And what is the problem here is there will be vibration, pain, pressure together. They will give you vibration, pain, pressure together in the question. Think about ventroposterolateral. Okay. Now coming to ventroposteromedial face sensation. If they talk about face, ventroposteromedial. All right. So guys, it's very easy. First time read करने पे दिक्कत आएगी. Second time read करने पे दिक्कत आएगी. But when will you be at the 10th reading of the first aid? You're good to go. Okay, if I am able to remember this very easily, then you guys are no exception. Okay, so that's all about hypothalamus and thalamus. Coming to limbic system. Now in limbic system, one important point is there. I will need you to write it down. Let's just first discuss what they are asking, what they have given here. So in limbic system, what actually includes limbic system? So they have hippocampus, amygdala, mammary bodies, anti-thalamic nuclei, cingulate gyrus. Okay, so these are the five structures of limbic system. Apart from this, they are responsible for what? Feeding, fleeing, fighting, feeling, and sex. So limbic system is also known as the emotional system of brain. आपको जो भी emotions आते हैं, whatever you feel like doing, that is given by the limbic system. Okay. Now remember this. Uh, A. These red arrows are very important because they will be giving you a destruction in the limbic system, and you have to identify in what part of this brain the area is damaged. So hippocampus कहाँ पे आएगा? You should know. Okay, so this is all what is given over here. Now extra point what I want you to write down, and it's very high yield, is hippocampus lesions. Okay, anterograde amnesia. Anterograde amnesia. What does it mean? Can't make new memories. Okay, there are two types of amnesia: retrograde, anterograde. Suppose injury has occurred in the head, and the patient is not able to remember the information that was before in his brain before the injury. Okay, injury से पहले जो भी था सब भूल गया. That is known as retrograde amnesia. If it is anterograde, so injury के बाद, okay, injury के बाद, if you are talking to the patient, okay, and after 30 minutes, when you again go back to the patient has forgotten what told to you. Okay, and this occurs frequently. That is what anterograde amnesia. And if it is anterograde amnesia, only then you will mark hippocampus. Okay. Another thing is, yeah, this only for hippocampus. So this is the most differential diagnosis for hippocampus lesion. Now from differential diagnosis from what? So another thing that you have to keep in mind over here is Wernicke Korsakoff syndrome. So can anyone tell me what is the vitamin deficiency over here? Come on, quickly.
Thiamine.
Yeah. Okay. All right. So B1 deficiency, thiamine deficiency. Now one thing. What is happening here? Here also the memory is being lost. The problem here is there is atrophy of mammillary bodies. Okay. There is atrophy of mammillary bodies. Whereas if they are talking about the hippocampus, think about anterograde amnesia. In the question, they will see you They will give you a question like this. A person came with the CNS injury and he was admitted to the hospital, and then after he woke up from the coma, or after he woke up from resting, doctor talked to the patient. He explained all the treatment plans to the patient. Okay. Doctor came back to the patient after 30 minutes. He asked the patient, "Do you remember?" Patient says no. Patient don't even remember the doctor's face. Okay, this is how the question will be asked. So at that time, think about hippocampus. Okay, all right. That's it for uh, this limbic system. And what was else? Yeah, I forgot to tell you one thing in the thalamus. Just write it down. Thalamic syndrome. Okay, it is most commonly asked, so I want you to don't miss it. It is usually a lacunar stroke. Okay. Second, contralateral sensory loss. Face, arms, legs. Third, mm, yeah, resolution can lead to long-term sensory pain. And yeah, another thing, it is on contralateral side. So severe pain by touching. Write this down because thalamic syndrome is very important. Okay, they will ask you. You will में पूछा है. So I want you to write it down. And if we look at the image, okay, if you okay, I'll tell you that. For now, write it down. And hypothalamic syndrome is if they want to talk about the hypothalamic syndrome, they will give you like any of this disorder over here. Most commonly, they like to ask is diabetes insipidus because in diabetes insipidus there are two types of diabetes insipidus: central and nephrogenic. So in central, what we have done? CNS injury. CNS injury में किसकी injury? Hypothalamus. Okay. So diabetes insipidus is the most common. And yeah, another thing they will ask is loss of temperature regulation. So if it is a loss of temperature regulation, it means suprachiasmatic nucleus is gone. And remember my word, suprachiasmatic इसका temperature वाला suprachiasmatic circadian rhythm most commonly asked question. Most commonly. You go for NBME, you go for UL. Direct question is the direct question. Okay. So don't make this small mistake. Very important to know. All right. Write this down. We'll move forward. See, whatever I am telling you, whatever the information I am telling you to remember it, if you do that properly, now your 90 to 95% of you neuro will be correct. Okay. Rest 5 to 10%, there can be very high level. Okay. So you can avoid that. But if you do this now, I'm telling you, I'm guaranteeing you 90-95% neuro questions will be correct by you. Okay. It's just you have to look at the information again and again. जब भी टाइम मिलता है फर्स्ट ईयर के पन्ने खोल के बैठ जाओ. That is the only way you can be so sure in the exam. Okay. So let's just go ahead. Dopaminergic pathways. Dopaminergic pathways, yes, they have asked this. And we have done the mesocortical and mesolimbic in the psychiatry. So it is about the positive symptoms and it is about the negative symptoms. Okay. Positive symptoms and negative symptoms. कमिंग टू निगोस्ट्राइटल. निगोस्ट्राइटल एक्स्ट्रा पिरामिडल सिम्टम जो कि पार्किंसंस में डिफेक्ट होता है. Okay, and coming to tuberoinfundibular system. So how they will ask tuberoinfundibular system is they will give you increase in prolactin and decrease in sexual activities. Okay, if prolactin is increasing, GnRH will be increased. This is the basic rule of endocrine. Okay, prolactin increase हो रहा है तो GnRH of course decrease होगा. Okay, so they will give you this criteria, and if they say there is a problem in the brain, which pathway of dopamine is affected here, so make sure tuberoinfundibular pathway is affected here, and this line is even given in the endocrinology in the prolactin part. Okay, I didn't cover there because I wanted to cover it here. All right, ignore this, no need. Coming to cerebellum. So cerebellum functions modulate movement, aids in coordination and balance. Okay, coordination and balance. Mark my word, general rule apply karo whenever you, if you find in a case कि patient का coordination ठीक नहीं है. If the coordination of patient is not good, he is not able to stand, he is not able to move his hand properly over there, or any problem where you feel the coordination is occurring, cerebellum. आंख बंद करके cerebellum करो. Okay, don't read any other information. Coordination दिख रहा है cerebellum. Okay, coordination हुआ cerebellum. Okay, so few important points are there that you need to remember in cerebellum. Let's just see. You have to remember the track. Okay, so this image is very important because they will say he signals to cerebellum are brought by which tract, and cerebellum signals from cerebellum are released by which tract. Okay, so this is important. uh, Middle cerebellar peduncle and inferior cerebellar peduncle, they bring in the signals. Okay, and superior cerebellar peduncle release out the signal. So this is very important. This diagram is very important. This is what they have given over here. Okay, this is what they have given over here. Important point, another one. Deep nuclei, lateral to medial, dentate, emboliform, globose, fastigial. Now see, they won't ask you the order over here. What they will say is, what they will tell you is, they will give you the MRI of cerebellum. Okay, and see, they won't even give you this skull wall. सीधा cerebellum को खोल के दे देंगे. If you have done NBME, in one of the question there is a beautiful image of MRI of cerebellum. Okay, ऐसा दे देते हैं and end में ऐसा कुछ दे देते हैं, something like this. Now they will ask you, there is a problem in one of the deep nuclei of cerebellum, and what they will do is, they will give you A, B, C, D. Okay, if this is a cerebellum, okay, if this is an anterior view of the cerebellum, what they will do is they will give you A, B, C, D. Now this is the medial, this is the lateral. Okay, so lateral में dentate है, medial में fastigial है. Okay, and they will ask you about dentate and fastigial only. Okay, they will ask you कि there is a problem in one of the deep nuclei on the lateral part of cerebellum or on the medial part of cerebellum. Okay, so this is how you will be selecting your answer. Sometimes dentate नहीं हुआ तो second answer will be emboliform. Okay, so just ये order याद रखना, lateral to medial वाला. Another point, if there is a problem in the lateral part and if there is a problem in the medial part, symptoms are different. Let's just see. Voluntary movement when injured, propensity to fall towards the injured. Okay, इसमें high level दिया हुआ है, मैं आपको लिख के दे देता हूँ. Yeah, so lateral में क्या हो रहा है? I'll write it down. Dysmetria, intention tremor, direction, force, speed, amplitude. Patient is not aware about any of this. Okay, patient को पता ही नहीं है सब क्या चल रहा है. Okay, and if it is medial lesion, so truncal ataxia, nystagmus, and that's it. So truncal ataxia most commonly. Yeah. Okay, so lateral and medial lesions are very important to distinguish because they will say in the exam lateral lesion है. So what all symptoms can be seen? Medial lesion hai. So what all symptoms can be seen? Now another way how they will ask you question is lateral lesion hai. So problem in the dentate nucleus. Medial lesion hai. The problem in the fascial nucleus. Okay, see this is all they have given in the bracket, but अपने को important नहीं लगता है. When we read, we don't feel this important, and this is why I am taking this course so that मैं आपको बता सकूं कि ये important है. Questions have been asked. Exam में भी question पूछेगा ये. Okay, so make sure just this one word is what going to help you. Okay, another question that will be asked in cerebellum. Finger to nose test. Direct question आएगा. The physician asks the like patient कि finger to nose से finger touch करो. Okay. Sometime in the embossed question bank. Okay, in embossed question bank, what they give is they gave the video of patient touching this. In U world also, I think you video is there and he's doing like this. Okay. If he's not able to do that, answer is cerebellum problem. Okay. Finger nose test is important. And another one is, yeah, Romberg test. Does anyone know what is Romberg test? Susti, Sherin, do you know what is Romberg test? Okay, I'll tell. Patient will be asked to close his eyes. Yeah,
And
Susti,
you won't be
continue,
able.
continue. बोलो.
Mm.
Okay, Susti पहले आप बोलो फिर शेरिन बोलो. Susti से. Okay, उनका network. Yeah, say, sorry, say. आपकी आवाज कट रही है. सुनाई नहीं दे रहा है. It's okay, network error है. Okay. Sherin, आप बोलो.
Like the patient will be asked to close his eyes and stand erect for like 60 seconds or more than a minute. If he's not able to do so, that is like a positive test.
Yeah. Closing eye, hands open, and he will be asked to see whether he is able to stand or not. Okay, this is one case. Second case, uh, doctor will touch the various like see, you can do this. Okay, you can do this like this is there. But patient won't be able to know what is there. Patient won't be able to know. Patient won't feel that it's something is coming. Okay, even if you close your eye, you have one sense कि हाँ कुछ आ रहा है, कुछ गर्म लग रहा है, कुछ ऐसा लग रहा है. Patient won't be having any of that. Okay, so that is what Romberg test is. But the most common in the exam, what they will ask you about the finger to nose test. Okay, so this is all about cerebellum. Okay, in the I think in NBME they asked about this also. My question was wrong. I remembered it. Yeah, they asked about this also. What which is the newest slope and which is the oldest slope, something like that. Okay, I don't remember exactly, but एक question ऐसा जरूर आ रहा है. So this whole cerebellum part becomes very important, and I think I am forgetting something. Okay, one thing. Purkinje cell. So these are cerebellar neurons. Okay, they receive numerous inputs and they release GABA. This release GABA is important. Okay, Purkinje cells release GABA, and that's it. And one more thing, cerebellar lesions will be ipsilateral. Okay, they will be ipsilateral because the tract crosses twice. Tract crosses twice. Okay, you know the crossing of tracks. Okay, so एक बार cross करेगा तो contralateral symptoms आते हैं, but there is a twice crossing of the track, so it is ipsilateral. So this was all about cerebellum. Okay, so लिख लो, then we'll move forward. All right, let's move ahead. We have basal ganglia. Now see, I know this is difficult to understand. If you understood well, very well and good, but it is difficult to understand. Okay, छोड़ दो, नहीं आएगा सवाल इसमें से. Okay, the problem here that will be coming is this striatum putamen plus caudate and lentiform putamen plus globus pallidus. Again, this is not the problem. What is the problem? This diagram. रट डालो डायग्राम को. Literally, I am saying you, please रट डालो डायग्राम को. They will give you this section and they will ask you to identify इधर क्या है, इधर क्या है, इधर क्या है, इधर क्या है. Okay, so please रट डालो. I'll show you the MRI image also for this, and you just have to remember the landmark or order. Okay, landmark और order याद रखो, ये भी याद रखो, सब कुछ याद रखो भैया. Okay, even this at mammillary bodies also. Okay, so I want you to remember this diagram top to bottom, अंदर से बाहर सब कुछ. Okay, एक एक identify करना आना चाहिए, because in every block where I was getting the neuro questions ना, mostly they were radio questions, mostly MRI CT पूछे. Okay, and they are very easy. Okay, if you are thorough with this diagram, they are very easy. All right, so no need to know anything in basal ganglia. Just remember कि इसका ये क्या होता है and function you should be knowing. Important in voluntary movement and adjusting posture, receives cortical input, provide negative feedback to cortex. Okay, so movement करने में help करता है. That is what the basal ganglia is. Now another thing, most common region for intraparenchymal hemorrhage, it is basal ganglia. Okay, basal ganglia is the most common location for intraparenchymal hemorrhage. This is one liner. They won't ask one liner. They will give you ask you to diagnose intraparenchymal hemorrhage, and based on that, where is this basal ganglia? Okay. So in this page, you have to remember this diagram where up to down, एकदम perfect. Okay. Coming to cerebral cortex region. Another thing, remember this diagram. Remember even the primary motor, primary somatosensory. Remember even the premotor. Okay, they have not mentioned here. Pre-motor भी याद करो, pre-sensory भी याद करो. I'll show you the image. हमारा image मैं बताऊंगा. Don't worry. Okay. Remember the occipital. Remember the temporal. Okay, so all this stuff you have to remember. Now, one important thing that is not given here is I'll write it down for you. Yeah, pre-motor दिया हुआ है, frontal I-field दिया हुआ है, prefrontal दिया हुआ है. Uh, just give me a minute. I'll write it down what is not given. Okay, right. I forgot one thing. When we were doing limbic system, na, yeah, यहाँ पे, here we studied about the amygdala also, right? So amygdala के symptoms क्या होते हैं, वो भी लिख लो. एक syndrome है. Does anyone know? Does anyone know amygdala का problem? Which symptom it is there? Can anyone try to recollect? Yeah. Yes. Perfect. Perfect. Kluver Bucy syndrome. Okay. This is very important. Here they will say damage to bilateral amygdala. Damage to bilateral amygdala. Now, how they will be presented to you is the presentation is very simple. There will be hyperphagia, another there will be hyperorality, hyperorality. Hyperorality means tendency to examine all with the mouth. ओके, सब कुछ देखेंगे तो टेस्ट करके देखेंगे क्या है. ओके, मिट्टी भी लगी होगी तो टेस्ट करके देखेंगे. ओके, एंड थर्ड, improper, not improper, I won't use improper, I will use inappropriate sexual behavior. Okay, so most common one, if you get confused between these two, this is the hint for you that the question is talking about Kluver-Bucy syndrome, inappropriate sexual behavior. Okay, so this is very important. लिख दो. India, what is the function of amygdala? So amygdala का function anyone बता सकता है कोई? Yes, Srishti, Sherin, anyone?
Uh, Emotions.
Yeah, you can say decision making. Emotions तो पूरा आएगा ना लिम्बिक सिस्टम का. Okay, so decision making is the function of amygdala. Okay, that's it. तो ये लिख लो, क्लूवर ब्यूसी सिंड्रोम वेरी इंपॉर्टेंट. प्लीज राइट इट इन द फर्स्ट एड ओनली. ओके, अलग से नोट्स मत बनाओ, फर्स्ट एड में ही लिखो. आई एम जस्ट गिविंग यू इन्फॉर्मेशन फ्रॉम माय फर्स्ट एड, नो अदर बुक्स आई एम यूजिंग. Alright, let's move ahead. Coming back to our cerebral cortex, see, you have to remember all the regions over here. Another thing is, now see, एक बात मैं बता देता हूँ, they have not mentioned over here, parietal lobe regions. Okay, parietal lobe को यहाँ पे problem हुआ, so what will happen is, it can cause spatial neglect. I'll explain you what is this, how they will give you in the question. Spatial neglect, it is contralateral, and yeah, everything is normal but can't feel. So what is the problem here? कि half of your body, you won't be able to feel half of your body. Paralysis नहीं है. Okay, there is no paralysis. Everything is normal, but you won't be able to feel. It's like half of the body has been detached from you. Okay, and in the question they will give you this कि uh, left side, the patient is not able to feel the left side of his body. Okay, it is sensory. Okay, not able to feel the left side of his body. Okay, where is the lesion? Answer will be right parietal lobe. Okay, contralateral है, spatial neglect. This is very important. Questions आया है. In the NBM it is there. Now frontal lobe में problem हुआ तो you know it is about the personality. Okay, so if there is a problem in the frontal lobe, so there will be personality disorder. Okay, and temporal lobe में हुआ तो temporal lobe में हुआ तो it can be auditory or intellectual problem. Okay, ऑडिटरी क्योंकि इधर ही आता है, टेम्पोरल लोब के पास ही आता है, इधर ही ऑडिटरी आता है. सो टेम्पोरल लोब इज इंपॉर्टेंट. ओके, लुक वेर इज द ब्रोकाज एरिया. ओके, लुक वेर इज द वर्निकेज एरिया, इधर इधर कहीं होता है. आई टेल यू, डोंट वरी. या सी, दिस इज इंपॉर्टेंट, दिस इज वेरी अंडररेटेड क्वेश्चन. प्राइमरी ऑडिटरी कॉर्टेक्स, ये वाले पार्ट में प्राइमरी ऑडिटरी कॉर्टेक्स है. ओके, एक्चुअली इसमें काफी कुछ नहीं दिया है. जस्ट वेट अ मिनट, आई विल सी एंड टेल यू. Okay, I'm not remembering it now. I'll mention you. I'll tell you in the group what I was trying to say. Okay, एक क्वेश्चन आया था. That's what I'm not trying to remember. कि about the superior field of temporal lobe or inferior field of temporal lobe. ओके, सुपीरियर एंड इंफीरियर का एक रिलेटेड एक क्वेश्चन आया था. ओके, एंड व्हाट इज द फंक्शन इज, दैट्स व्हाट आई एम नॉट एबल टू रिकलेक्ट. ओके, सो ये जो होगा आई विल ट्राई टू write it in the group after we are done. Okay, now we have seen the cerebral cortex, we have seen this diagram. Okay, now I'll show you the images. These images from are from the Melman Medical, and whatever the images I'll be showing you, ratify those images, rest all you can avoid. Okay, so आओ देखते हैं पहले. Yeah, this is the image. First thing what you will do is when you receive image like this, divide the brain into two parts. Now see, when you see the brain like this, when this V wala part is always the posterior part and this is anterior. Okay, so I divided the brain into two parts and this is what is known as the central sulcus. Okay, अभी central sulcus के आगे हुआ, so it is going to be motor, and if it is back it is sensory. You are able to collect, you are able to go with me, so she's sharing, give me a thumbs up if yes.
Yeah.
समझ गए ना? Okay, okay, so now
Uh-huh.
one thing, it is medial and it is lateral. This is the second thing that you will be looking for, medial and lateral. Okay, so अभी मुझे बताओ ये रीजन कौन सा हो सकता है. ये रीजन, फॉरगेट अबाउट लेटरल मीडियल, व्हाट आई एम सेइंग. सेंट्रल सर्कस है, उसके एंटीरियर में कौन सा रीजन होता है? कम ऑन क्विकली.
Primary motor,
यस, एंड पोस्टीरियर में.
somatosensory.
ओके, अभी मैं एक और लेयर आगे जाऊं, यहाँ पे मैं एक और लेयर आगे जाऊं, तो यहाँ पे कौन सी रीजन होगी?
Motor
या सो इट
cortex.
विल बी प्री मोटर. ओके, सिमिलरली यहाँ पे सोमैटोसेंसरी एंड प्री सेंसरी. ओके, नाउ व्हाट दे आस्क इज, दे आस्क द क्वेश्चन कि प्री मोटर कॉम्प्लेक्स का क्या काम है. लाइक what is the function of premotor complex is, it will prepare your brain to carry out the motor action. ओके, सिमिलरली इन प्री सेंसरी, ब्रेन को प्रिपेयर करेगा कि ये एक्शन निकालना है, और एक्शन निकालने का काम इज बिकॉज ऑफ इज द फंक्शन ऑफ प्राइमरी मोटर. ओके, सो वेन एवर यू गेट दिस इमेज लाइक दिस, ऑलवेज फाइंड, देखो सेंट्रल सर्कस को भी फाइंड करने का तरीका है. सी, यहाँ पे देखोगे कि ब्लड वेसल्स पतले पतले, एक पॉइंट आएगा, देयर विल बी वन पॉइंट वेयर यू विल फाइंड द ब्लड वेसल्स लिटिल बिट फैट, एंड दैट इज व्हाट गोइंग टू बी योर सेंट्रल सर्कस. ओके, ऐसे भी कर सकते हो, ऐसे भी कर सकते हो, वो लोग ऐसे भी पूछ सकते हैं, ऐसे भी पूछ सकते हैं, ऐसे भी पूछ सकते हैं, ऐसे भी पूछ सकते हैं. ओके, जस्ट कीप योर बेसिक सिंपल. सेंट्रल के ऊपर ऐसा है, सेंट्रल के नीचे ऐसा है. समटाइम दे माइट गिव यू ए बी सी डी ई एफ जी, सो यू नो नीड टू focus about the central circle. Okay, so images like this, questions like this are 100% to be appear on your exam, and you should be thorough with them. All right, तो ये एक इमेज है, ये दूसरी इमेज है, एंड या दिस इज अनदर इमेज. ओके, सो मैं आपको बता दूंगा क्या है इसका, ये सब क्या है, आई विल लिटरली टेल यू. बट व्हेन यू लाइक व्हेन यू आर फ्री, try to figure out what is this, what is this, what is this, what is this. This is very difficult, even I found it very difficult, even now I don't remember. Okay, so but ये आपको करना पड़ेगा because questions will be asked. Okay, and sometimes either they will ask identify the structures mark, and sometimes they will give you a case and you have to identify where the problem is occurring. Okay, so come on, let me give you one case, you tell me what can be the answer. Okay, मैं एक केस देता हूँ. Patient had atrial fibrillation. Okay, and there was numbness, tingling in right leg. Okay, okay, before doing this question, come back to the first aid. एक कॉन्सेप्ट क्लियर कर देता हूँ, तो आफ्टर दैट यू विल बी एबल टू डू दैट. इग्नोर दिस. नो नीड टू डू सेरेब्रल परफ्यूजन. इग्नोर. कमिंग टू होमनक्यूलस. ओके, होमनक्यूलस में आपको याद रखना है कि मीडियल साइड ऑफ ब्रेन इज रिस्पॉन्सिबल फॉर द लोअर पार्ट एंड दिस लैटरल पार्ट बाकी सब में आएगा. ओके, दिस इज व्हाट होमनक्यूलस रोल इज. कुछ ज्यादा नहीं, कुछ कम नहीं, इतना याद रखो. इफ दे आर आस्किंग यू अबाउट, ओके, वो क्वेश्चन में भी इफ आई आस्क यू अबाउट द मीडियल पार्ट, so it means the problem is occurring in the lower part of the body. Okay, or if I'm going away from the medial towards the lateral, हाथ में हो रहा है, फेस में हो रहा है, everywhere. Alright, so ये कॉन्सेप्ट आपको याद रखनी है. एंड बेस्ड ऑन दिस आई विल आस्क यू द क्वेश्चन. एट्रियल फिब्रिलेशन प्लस नमनेस एंड टिंगलिंग इन राइट लेग. ओके, मैं आपको ये इमेज में पूछना चाहता हूँ. ये इमेज में आई एम आस्किंग यू दैट क्वेश्चन. आई विल राइट फॉर यू अगेन, नो प्रॉब्लम. आई वांट यू टू आंसर दिस करेक्टली. एट्रियल फिब्रिलेशन प्लस numbness and tingling in right leg. Okay, I am giving you the direction. This is the right side and this is the left side of the brain. और ये सब इमेज रब, सॉरी, ये सब मैं रब कर देता हूँ आपके लिए. Read the question carefully and answer me this. ये राइट में अफेक्ट करेगा या लेफ्ट में अफेक्ट करेगा? बोलो. इज द पेशेंट या इज द पेशेंट एबल टू आइडेंटिफाई कि ये राइट में अफेक्ट किया है, लेफ्ट में अफेक्ट किया है? अगर वो बोल रहा है कि मुझे राइट में हुआ है, तो ब्रेन के कौन से पार्ट में अफेक्ट करेगा, बताओ मुझे.
Left.
यस, इट इज गोइंग टू बी लेफ्ट बिकॉज दिस इज गोइंग टू बी कॉन्ट्रालैटरल. राइट साइड का लेफ्ट लेग में करेगा, लेफ्ट साइड का राइट लेग में करेगा. ओके, तो इफ दे हैव सेड राइट, आंसर इज लेफ्ट. ओके, दिस इज द फर्स्ट क्वेश्चन. सेकेंड क्वेश्चन, मीडियल और लैटरल? आंसर, कम ऑन.
Medial.
व्हाई मीडियल सृष्टि? एक्सप्लेनेशन दो.
According to the homunculus,
Yes,
medial
yes,
lower
perfect,
limbs.
perfect, perfect. Now third, is it anterior or posterior to central sulcus? Tell me the answer.
Posterior.
Posterior. Why posterior? Explain it.
Because sensory cortex lies in the behind the
Perfect,
central surface.
perfect. Okay, posterior. So अभी मैं आपको बोलूं, इसमें से मेरे को बताओ कौन सा लेटर इज एक्चुअली गिविंग यू दिस डायग्नोसिस रीजन. कौन सा हो सकता है?
F.
Perfect. This is how the questions are going to come in exam. Okay, एनबीएमई में ऐसे बहुत सवाल है, एग्जाम में भी ऐसे ही आएंगे. Okay, so many questions will be there in exam like this. Okay, you will be tired to do, but you have to apply all this logic and do it. Okay, and this is why I enjoy solving neuro questions most, because they actually ask us to apply the logic and the concept. Okay, so this is how the questions will be asked. Okay, chalo, another question. Instead of tingling and numbness, they will give you weakness of left arm. Weakness of left arm. So same question for me. Same question for you. Right or left? Come on quickly.
Right.
Right.
Right. Medial or lateral?
Lateral.
Anterior, posterior?
Anterior.
Yeah, anterior because यहाँ पे motor complex है. Weakness of left arm है. Sensory वेंसरी सब बराबर है. Okay, ऐसे ही क्वेश्चन आएंगे. Just don't worry about anything else. ये तीन कॉन्सेप्ट याद रखो. कॉन्ट्रालैटरल, रिमेंबर द रीजन. मीडियल और लैटरल में अपर लिम लोअर लिम का फंडा याद रखो. एंड सेंट्रल सर्कस के एंटीरियर मोटर वाला है, पोस्टीरियर सेंसरी वाला है. Okay, so this is how they are going to ask you. So many questions will be coming to in exam. You will enjoy solving them. Okay, so just tell me, should I erase everything or should I just keep it like this? क्योंकि image I have to share in the group. So आप बोलो. अरे बोल दो।
The free.
ठीक है, कमान यार, कोई बात नहीं, चलो। तो दिस आर्टियल डिस्ट्रीब्यूशन इज इंपॉर्टेंट। एंटीरियर सेरिब्रल, पोस्टीरियर सेरिब्रल एंड मीडियल सेरिब्रल। एंटीरियर सेरिब्रल आएगा मिडियल वाले पार्ट में, पोस्टीरियर आएगा पीछे में, और साइड में जो लेटरल होगा वहां पे मिडियल सेरिब्रल। ओके, दिस इज द बेसिक, डोंट वरी, स्ट्रोक्स में वी विल बी डूइंग दैट अगेन। वाटरशेड जोन, क्वेश्चन तो आया नहीं है, एक क्वेश्चन है यू वर्ल्ड में रिगार्डिंग दिस, बट यू कैन अवॉइड इट। एसीए एमसीए वाटरशेड, पीसीए एमसीए वाटरशेड, ओके, नथिंग एल्स। Moving ahead, circle of village. Yeah, circle of village, very important. This diagram is not good. Refer your old diagram given in anatomy book or you can refer to Google. Now, circle of village में भी वो लोग ऐसे पूछते हैं. Okay, circle of village में भी ऐसे पूछते हैं. So let's just remember this diagram. I'll tell you फटाफट क्या क्या है. A is ACA, anterior cerebral artery. B is anterior communicating artery. C is MCA. D is ICA, internal carotid artery. Now E is posterior cerebral artery. F is basilar artery, and G is vertebral artery. Okay, इसकी डायग्राम को याद रखो. They will give you the case, कौन से रीजन में स्ट्रोक हुआ है, in which region the stroke is occurring, and based on that you will select the artery. Okay, and regarding the artery, this is the another question that was asked in NBME. Okay, यूएल में नहीं पूछा, एनबीएमई ने पूछा. तो चलो देखते हैं इसमें आंसर क्या होगा. A is internal carotid artery, B is external carotid artery, then D is vertebral artery. Okay, V is vertebral artery. C is right common carotid artery, and what else you need to remember? ये भी कुछ तो है. E, yeah, E is subclavian artery, and F is brachiocephalic artery. Okay, and J is aorta. एनबीएमई का सवाल था, सेम इमेज है एनबीएमई से, वही उठाया है. ऑलराइट, दिस इमेजेस आई विल शेयर इन द ग्रुप, डोंट वरी. ये जो इमेज याद रख लेना, अगर इसके जैसा कुछ भी इमेज आया यू विल बी गुड टू गो. ऑलराइट, मूविंग अहेड. ओ यार वो तो भूल ही गया, एक मिनट एक मिनट. दिस तो आई विल शेयर इन द ग्रुप, यू जस्ट रिमेंबर व्हाट आर द लोकेशंस. ओके, इसमें डिस्कस करके कोई मतलब नहीं है, यू हैव टू रिमेंबर देम. एक रेनियल नर्व है, ये भी नहीं है. या दिस वन, या दिस वन. दिस इज वन ऑफ द एग्जांपल आई वाज टॉकिंग अबाउट बेसल गैंग्लिया का. इसमें ये लोग पूछते हैं कि इसमें ऐसा पूछ लिया था क्या, दे गिव द केस. ओके, दे गिव द केस ऑफ पार्किंसंस. ओके, and another case was of ischemic stroke. Okay, so in the Parkinson's, now you have to identify कि यहाँ पे पार्किंसंस कहाँ अफेक्ट होगा. कैन एनीवन ट्राई टू, पता है किसी को? नो, ओके, नो प्रॉब्लम, आई विल टेल. तो ये जो एरिया है ये तो ऑर्बिटल वाला है, आई का है. दिस इज समथिंग यू नॉट नीड टू नो. दिस इज द मीडियल ऑर्बिटल फ्लोर. ओके, याद करने की जरूरत नहीं है. डी, ये जो पूरा रीजन है ना, ये मिड ब्रेन है. सी, इट इज parietal lobe, and F is occipital lobe. Now, what they asked was in the NBME, what they asked was substantia nigra is present over here. Okay, so answer D होगा क्योंकि substantia nigra mid brain के अंदर है. So mid brain is the answer. Okay, NBME asked this question. Okay, and the remaining 5% जो मैं बोल रहा था, that remaining 5% involves this कि वो आप नहीं कर पाओगे, difficult होगा. Okay, so that is what remaining 5% is. But I told you, NBM is also going to tell you. Melman Medical, if you refer, he is also going to tell you. Okay, so I don't think you should have any excuses कि मुझे नहीं आया. Okay, so this is one of the image. ये मैं आपको बताता हूँ क्या है. All right. So coming back to our discussion, that is first year में आ जाओ वापस. So सर्कल ऑफ विलेज इसलिए इंपॉर्टेंट है, आपको सही ब्रांचेस आनी चाहिए। ड्यूरल वेनस साइनस इग्नोर, नॉट नीडेड। वेंट्रिकुलर सिस्टम इग्नोर, नॉट नीडेड। ब्रेन स्टेम, ओके गाइस, लेट्स टेक अ 5 minutes ब्रेक। 5 minutes के बाद वी विल कंटिन्यू ब्रेन स्टेम एंड वी विल हैव क्लास टिल 11-11:30। जब तक जितना होता है वी विल डू इट। 5 minutes ब्रेक ले लो। All right. Yeah, before the break, I said 11:30. It's over here, 11:30. I'm in China. So, 9 o'clock तक will continue. Okay. 8:39 मेरी ताकत पे डिपेंड करेगा वो. All right. Let's continue then. Brainstem. Okay. So brainstem में instead of remembering this image ना, I'll share this image in the group. ये image जो है ना, ये image को रट डालो. Why not this and why this? Because they ask the location like this. Okay, they ask the location like this. Okay, when you will solve UL and when you will solve NBA में ना, उसमें they will give you more bad images. Okay, ये तो मैंने बस एक एग्जांपल दिया. ऐसे ही images आएंगे. The images will be like this only. They won't be pictorial. Okay, pictorial तो easy होता है. They will give you images like this and you have to count. ये कौन सा है? 1 2 1 तो दिखता ही नहीं है. 2 3 4 5. They have to count. You have to see where it is going on. Okay, so this is little tough I feel, क्योंकि इसमें 5 और 6, 4 और 5 इसमें दिक्कत आती है करने में. Okay, so how to remember, how you can tackle this problem is just look at the regions around it. कि हाँ, इधर इसका लैंडमार्क है तो 5 निकला, इधर इसका लैंडमार्क है तो 6 निकला. अभी ये इसका लोअर पार्ट ऑफ पॉन्स है तो इधर से ये निकल रहा है. समथिंग लाइक दैट. Make your own landmark and do like this, because for sure gross pathology specimen will be given to you and you will have to identify the cranial nerve. Okay, they won't give you any case also. This image, identify the nerve marked in this image. Image ही दे देंगे. Okay, that's it. So cranial nerve, this is what you need to remember. All the this 4 cranial nerves are medial, 4 cranial nerves are in the medulla, 4 exit the pons, and 4 are above the pons. Now why this is important, I'll tell you. Ignore this. Okay, moving ahead. Cranial nerve nuclei, छोड़ो कोई ये सब नॉर्मल बात है. न्यूक्लियस ट्रैक्टस सॉलिटेरियस 8 9 10, एम्बिगुअस 11 10, डोर्सल 10. ये cranial nerve याद रखना and nucleus याद रखना. That's it. You are good to go. With this, all right. So moving ahead, we have cranial nerves and vessel pathways. Okay. So cranial nerves and vessel pathways. इसमें आपको ये याद रखनी है. You have to remember this कि location and what nerves are going from that. Okay. Easy है. No need to worry. बार बार देखो. Easy है. Okay. Don't worry about this image. Image नहीं पूछेंगे. ये image कुछ नहीं पूछेंगे. They won't ask that. They will ask you that the nerve that was causing this problem was occurring, was passing through the superior orbital fissure, was passing through the foramen rotundum, foramen ovale, or they will say the nerve that is causing this is passing from which area. All right. So पहला वाला तो obvious है, वो आप देख के आप पता लगा लोगे. वो देख के आप पता लगा लोगे बाद में. Okay, so based on this you can make the diagnosis. Okay, sorry, diagnosis नहीं, location से nerve identify कर पाओगे. Okay, so just remember the location and just remember the nerve and the structures that are passing through that. All right, now coming to arteries. Don't worry, arteries मैं बाद में बता दूंगा, अभी ignore करो. Cranial nerves, of course I'm not going to detail over here. You should be knowing the function of each and every nerve. Okay, because जो stroke के questions आएंगे ना, and all those symptoms like Wallenberg syndrome, then Paranoid syndrome, all those जो stroke के questions आएंगे ना, उसमें you need to remember two things: the arterial supply and cranial nerve के function. Okay, so do everything, do all the functions. आपको सारे function differences याद आने चाहिए कि lacrimation के लिए कौन सी nerve है, eyelid retraction के लिए कौन सी nerve है, lateral rectus, medial rectus, sorry, you should be knowing everything. Okay, don't compromise anything over here. Try to recollect everything, and yes, also recollect this. Sorry, also remember this. Some say marry money, but my brother says big brains matter more. Okay, this is how you will. This is the best mnemonic I have found till now. If you have different one, go with that. Okay, so yes, you have to remember which are sensory, which are mixed, and also remember this cranial nerve. Okay, now coming to this. Afferent and efferent. This is also important. How important? They will give you any of these reflexes, okay? Gag reflex or Georgic reflex. And directly the question will be asked. The afferent now responsible for this, efferent now responsible for this. तो ये आपको रखना है. And it, I know it becomes difficult, but take the printout, or whenever, wherever like you are, like you have the notes, निकालो, लगाओ. Okay, this is very difficult. I know it's difficult to remember, but you have to do. Direct questions आया है. Okay, so the thing is, where you are getting the chances of direct question, that is your score booster in this exam. Okay, if it is about logical applying, we will all fall back. Okay, but if it is a direct question, you should not miss it. You will regret it later. All right, moving ahead. Okay, mastication muscles important है. They ask the function to temporalis, masseter, lateral pterygoid, middle pterygoid. Okay, the lateral pterygoid protrudes the jaw. All are innervated by phi 3, and these are closing the jaw. तो याद रखना ये. Okay, leave this, no need. Leave this, no need. Okay, छोड़ दो, एक भी क्वेश्चन नहीं आया है. Now yeah, important point. Spinal cord. Now what my point is, spinal cord का जो होगा ना, we will do with spinal cord pathology. Okay, we won't do it now. Okay, spinal cord के जो syndromes होंगे ना, हम उसके साथ इसको करेंगे. Okay, so इसको अभी छोड़ देते हैं. We will do it with the spinal cord pathology. Now yeah, over here you can ignore this primitive reflex. This is a part of pediatrics. Step 2 सीखे, step 1 में नहीं आएगा. तो ये part छोड़ दो. नेवर आ, ना एनबीए में पूछे ना यूएल पूछे. कमिंग टू क्लिनिकल रिफ्लेक्स. Very high yield, and this you are going to make it wrong if you don't do it properly. Okay, H1 H2 L2 L4 C5 ये सब याद रखने हैं. सब याद रखने हैं, तो इसको भी लिख के चिपका दो. Okay, so these two things are to be ratified over here. This afferent efferent wala and this clinical reflexes, because they will give you कि पटेला पे टेस्ट किया, एचिलिस पे टेस्ट किया, एनल रिफ्लेक्स नहीं है, क्रेमास्टिक रिफ्लेक्स नहीं है. They will give you something like this, and then you will have to identify what are the nerve roots. Okay, so yeah, this is very important. They have already given the mnemonic like a rhyming, so you can use them and they are good to go. Okay, ये और वो रट डालो, for sure question आएगा. NBME has so many questions. All right, landmark dermatome. So what are important over here is C3. Okay, so C3 का अगर आया तो phrenic nerve याद रखना. Okay, then T4 आया, so it is at a nipple. Okay, then if they ask C5 C6, so they are asking you about the biceps and triceps. Okay, ऊपर देख ही लिया अपन ने, but this is also you have to remember. T10 is umbilicus. Okay, and that's it. These three are very important. C3 phrenic nerve, T4 nipple, T10 umbilical. All right, so I think with this we have finished with the anatomy part. If you guys have any doubt in anatomy, abhi पूछ लो, because now we'll be starting pathology, and pathology is also so vast. तो वापस anatomy पे jump करना, it will be a little bit hectic. So see, Sherin, any doubt in the anatomy part, embryology part? कोई doubt है?
नहीं नहीं, अभी तो कुछ नहीं. It's all good.
कुछ नहीं. ओके,
नहीं.
सब क्लियर आउट हो गया. शेरिन, आपकी पहली क्लास है, आई थिंक, आई होप क्लियर आउट हुआ,
Yeah,
कुछ फायदा
yeah,
हुआ
it's
ज्वाइन
also.
करने का.
हाँ 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 हुआ.
ओके.
Yeah.
ओके, नो वरी. ऑलराइट, सो लेट्स स्टार्ट विद द पैथोलॉजी. सी, ये है ना, ये अभी मत पढ़ना. डोंट रीड दिस नाउ, रीड दिस आफ्टर यू फिनिश स्टडिंग पैथोलॉजी. काटना नहीं है, इंपॉर्टेंट है, दिस इज इंपॉर्टेंट. डोंट रीड दिस नाउ, read this after you finish the entire pathology, after you are thorough with the entire pathology. This is like a revision for you. Okay, they have just given a summary of all the syndrome. Okay, so this is now a revision for you. Do this after you finish the entire pathology. Moving ahead, ischemic brain and disease. So let's just see what is important over here. Just a minute. Ischemic brain and disease stroke. So the first question that they like to ask is about the most vulnerable region of the brain that is responsible for this. The hippocampus, neocortex. The first one is hippocampus. Second is neocortex. Okay. And after that you will select watershed areas. First time what we do watershed areas है. So you must be thinking the first hypoxia तो इधर ही होगा. Okay, watershed areas है. Okay. So watershed areas एकदम last में आएंगे इधर ये. Most common is hippocampus and neocortex. These two are very important. Another thing. After what time the injury occurs? 5 minutes. 5 मिनट के बाद न्यूरोनल इरिवर्सिबल इंजरी हो जाती है. उससे पहले इस्चेमिक स्ट्रोक, माइल्ड इस्चेमिक स्ट्रोक, ट्रांजिएंट इस्चेमिक स्ट्रोक अटैक, ये सब सिम्टम्स दिखते हैं. ओके, so this is very important. The location is very important. Second thing, non-contrast CT and CCT will be used to diagnose it. Okay, and another one is this histologic features. Okay, in ischemic stroke or in the ischemic brain disease, they won't focus on any other thing. वो नहीं पूछेंगे treatment क्या होगा, what you will do, what is the investigation of choice. They won't ask all of this. That is the part of step 2 CK. What they are going to focus on step 1 is they will ask you, they will say ischemic stroke हुआ है. Okay, that was the ischemic brain disease. Then they will ask you what will be seen in the pathology. Okay, sorry, what will be seen in the tissue after 24 to 72 hours, or after 3 to 5 days, or after 1 to 2 weeks, or in first 12 to 24 hours. They will ask you this. Okay, and the most confusing is how they confuse you is sometimes they will ask you what can be seen in 5 to 10 hours. Your answer will be nothing. Your answer will be the brain tissue is normal. Okay, they will confuse you. Okay, so अगर 12 hours से पहले पूछ रहे, if they are giving you before the 12 hours, say it is normal, and then rest you can follow. 12 to 24 में eosinophilic, everything is important over here. Okay, जो भी दिया है, whatever it is given here, everything is important. Okay, but one thing, if it is given less than 12 hours, be alert and think 12 hours से पहले तो बुक में था ही नहीं. It means it is going to be normal. All right, that's it. Ischemic brain stroke में इतना याद करना है. Moving to ischemic stroke, nothing यहाँ पे आप avoid कर सकते हो ये सब. One important point you need to remember here is TPA. Okay, now the question will be when the TPA is contraindicated or when you should give TPA. Okay, this is the question. So write it down. Within 3 to 4.4 hour of onset. Okay, mostly 4.4 hour of onset तक आप TPA दे सकते हो. Okay, there is no risk of hemorrhage. Another, uh, they have not given over here. I'll write it down for you. No risk of hemorrhage. Third, previous history of surgery. Then INR greater than 1.7. BP greater than 185 by 110. Platelets less than 100K. Okay, and glucose less than 50 mg per deciliter. And last one is PTT is elevated. So ये सब parameters आप check करोगे. You will check all of these parameters. Okay, and based on that you will say that the TPA is contraindicated. Okay, this is the information from UWorld that I have written it over here. ओके, सो बी थोरो. टीपीए देख के सीधा नहीं देना है. ओके, इन द क्वेश्चन यू माइट से, you might find all these conditions, so you will say TPA is contraindicated. This is the MRI that you need to remember. This is not MRI, I think this is NCCT. I don't know what is this. I am very weak at radio. जो भी है याद रखो. And this is the changes in the brain. This is the TPA का contraindications and indication. Okay, so these three things are very important. Now coming to one another topic, that is transient ischemic attack. Okay, so similar condition will be there. Okay, similar condition to the ischemic brain stroke, only difference कि 15 मिनट में it will be resolved. It will resolve within 15 minutes. Whereas ischemic brain stroke it doesn't resolve. Okay, simple है. They will say you that the symptoms are being resolved within the 15 minutes or within 10 minutes. Your answer will be transient ischemic stroke. Okay, that's it. All right. Cerebral edema. One question in NBME and one question in UWorld. Okay, so we have to do fluid accumulation in brain parenchyma. So ICP increase हो जाएगा. Cytotoxic edema, vasogenic edema. Now, what is they have asked? What is the mechanism here? Okay, cytotoxic edema Q, vasogenic edema Q, and this isn't there in the old edition of first aid. They have added it over here. Why? Because UL and NBME has added it. Okay, so let's just see. Cytotoxic edema, intracellular fluid accumulation due to osmotic shift. Okay, इंट्रासेलुलर सोडियम की वजह से caused by ischemia. All right, vasogenic में extracellular fluid accumulation due to disruption of blood brain barrier caused by ischemia late. Please remember the causes over here. Please, the causes are very important. UL में एक क्वेश्चन दिखेगा, NBME में भी दिखेगा. Okay, it wasn't there in the old edition, but they have added it. All right, moving ahead. Effect of stroke. Now, before beginning and before moving for towards the effect of stroke, I hope you both have watched BNB. Okay, BNB देखा है, and you will be knowing what I am going to talk about in BNB now. ये जो फॉर्मूला बताया है ना BNB ने in the brainstem video, this कहाँ लिखूं, यहाँ पे लिख देता हूँ. Lateral medial brainstem, PCA ICA PICA, basilar ASA. याद आ रहा है? कैन एनीवन रिकलेक्ट इट? बोर्ड्स एंड बियॉन्ड में ये दिया हुआ है. ऑलराइट, एंड नेक्स्ट वन इज दिस इज मिड ब्रेन, दिस इज pons, and this is medulla, and the cranial nerve that will be interfering over here are 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And in order to know कि medial होने वाली है या lateral होने वाली है, divide your cranial nerve by 4. So इसमें आंसर होगा 4. Sorry, not 4. I'm sorry, not 4. 12. You have to see कि 12 के factors कौन से. Okay, 12 के factors कौन से you have to see. So 3 भी होंगे, 4 भी होंगे, यहाँ पे 6 होगा, and यहाँ पे 12. Okay, 3, 4, 6 and 12. If these nerves are involved, they are going to be medial. Okay, and rest of the nerve lateral. So let me just explain you in general what BNB has said, and mark my words, ये भी आप लिख के अपने सामने लगा दो, because the problem will be in remembering ICA, PICA, basilar ACA. Okay, there will be problem. You will confuse ICA ऊपर था कि PICA ऊपर था, basilar ऊपर था कि ACA ऊपर था. Okay, this will be problem arising. Now here, what is actually this telling is, I hope you must have seen this, but still, if you have not, let me just explain you. कि in the stroke, now they will ask you कि lateral region है, medial region है. Okay, lateral region है, so what artery is involved? Which artery is involved? Medial region is there, which artery is involved? So how you will be making out which artery is involved? You will look at the cranial nerve के symptom. Okay, which cranial nerve is involved? Based on that, you will be picking out whether it is lateral or medial. How you will be picking out? You will look at the cranial nerve and you will think about which cranial nerve is this. If it is a factor of 12, then it is medial. And if it is not a factor of 12, it is lateral. Okay. Another thing, you will think about the number of cranial nerve. You will see if it is 3 and 4 cranial nerve, it is the lesion is in midbrain. If 5, 6, 7 it is involved, it is in the pons. If 9, 10, 11, 12 are involved, it is in the medulla. All right. And based on this information, 100% you will get the correct answer if you follow this rule very properly. Even in India, for NEET PG, this rule is used. Okay, NEET PG FMG सबके लिए ये rule यूज होता है. So USMLE also follows this rule. Remember that rule and you are good to go. इसके अलावा कुछ करने की जरूरत नहीं पड़ेगी. Nothing you have to do. All right. So I hope you are clear with this. And one thing, let me tell you, anterior circulation discuss kar lete because it has nothing related to the cranial now. Okay, so let's just discuss this. Anterior cerebral artery, middle cerebral artery, ACA and MCA. Okay, ACA lower limb, MCA upper limb and face. Here also homunculus is applied. When we saw the homunculus, middle ये जो part था, we saw the ACA circulation. Okay, and here we saw the MCA circulation. If you remember, go back and do look at that. Okay, so if they are talking about the stroke paralysis in the lower limb, think about ACA. If face and upper limb, MCA. Okay, पहला फंडा इधर क्लियर हो गया. Okay, second, Wernicke aphasia. We will do about aphasia later. But if they are asking about Wernicke aphasia, your answer will be MCA. Okay, because it is involving in the face, right? Face में बोलने की दिक्कत आ रही है. Face से बोलते हो ना? So MCA. Wernicke aphasia, MCA. All right. Another thing that you need to remember here is Wernicke aphasia is associated with right superior quadrant visual field defect due to temporal lobe inversion. Superior quadrant is high yield. Right superior quadrant. Okay. So ये तो हो ही गया कॉन्ट्रेंटल पैरालिसिस एंड सेंसरी लॉस. कॉन्ट्रेंटल पैरालिसिस एंड सेंसरी लॉस, लोकेशन लोअर लिम्ब एंड अपर लिम्ब, एफएजीआई डोमिनेंट. ओके, तो ये सब तो आपकी जनरल इंफॉर्मेशन है. बट इफ यू आर थिंकिंग अबाउट एनसीए एंड एमसीए कंफ्यूजन, लोअर लिम्ब में एमसीए, अपर लिम्ब में लोअर लिम्ब में एसीए, अपर लिम्ब में एमसीए. ऑलराइट, मूविंग टू लेंटिकुलर आर्टरी. आई हैव रिटन हियर, आई हैव एक्सप्लेन टू समवन बिफोर. तो क्लासिक केस आपको ये देंगे, फेशियल रूप, and there will be this lacunar infarct due to microatheroma and hyaline arteriosclerosis, lipohyalinosis. Okay, and along with that, they can give you the problem in caudate, putamen, globus pallidus. All right. Now, one important thing over here: contralateral paralysis. It is a pure motor stroke. Sensory symptoms नहीं आएंगे. कोई numbness, कोई tingling, nothing will be seen. Pure motor stroke. Paralysis है. He's not able to move this. Okay, he can feel it. Pure motor stroke, if you hear, lenticular striate artery stroke. Okay, see, it is given a pure motor stroke, and this is important. Lipohyalinosis is important, and facial droop will be given to you because facial muscles will also be involved, right? So facial muscle droop हो जाएंगे, you won't be able to chew, eat, smile, everything. Okay, so anterior circulation में important था. बाकी this you can always refer this. Okay, ये, and based on this you can even name them. Lateral pontine. ओके, नाम भी दे सकते हो. लेटरल पॉन्टाइन मतलब आई का स्ट्रोक का प्रॉब्लम है. ऑलराइट, सो इफ यू हैव बीएनबी एंड इफ यू हैव नॉट वॉच दिस वीडियो, बीएनबी में न्यूरो में जाके ब्रेन स्टेम का पार्ट देख लेना. ये एक्सप्लेन दिस along with the example. Okay, so we are done with the stroke, and yes, you should be familiar with the images. This is the ACA का MCA का stroke. This is, I think, lenticular striate का stroke. Caudate lobe और globus pallidus में problem है. Am I right? Yeah. This is में PCA का stroke होगा, पाइका या PCA का stroke होगा based on the symptom. All right. So we are done with this. Neo intraventricular छोड़ दो, नहीं आया है. Okay guys, so you are clear with the stroke. Stroke से definitely question आएगा, and based on this and based on ACA का knowledge, your strokes will be easily solved. Okay, strokes में गलती नहीं करना. You should not afford, you cannot afford a mistake in strokes because these are all score boosters. याद करना है, apply करना है. Okay, let's move ahead. Intracranial hemorrhage. First thing I would like to tell you, be familiar with the images. 50% डायग्नोसिस तो इमेजेस देख के ही हो जाएगा. ओके, 50% डायग्नोसिस इमेजेस देख के हो जाएगा, मार्क माई वर्ड. सेकेंड थिंग, most commonly asked is subarachnoid hemorrhage, and they will say worst headache of my life. Patient will complain worst headache of my life. Okay, so ये important है, worst headache should be there. Another term for worst headache of my life is thunderclap headache. Okay, thunderclap headache. So ये तो important है. Now there can be bloody or yellow लंबा पंचर. लंबा पंचर जब भी आप करोगे तो there will be bloody fluid collection or yellow fluid collection. So that is also known as gentochromic लंबा पंचर. Another, vasospasm can occur due to blood breakdown or roughly 3 days after hemorrhage. And here they asked one common question. Nimodipine is used to prevent or reduce vasospasm, and this is very high yield. You must have come across this, but you might not be knowing it. Subarachnoid hemorrhage का case होगा. There will be a case of subarachnoid hemorrhage, and they in the option they will give you which drug will you give in order to prevent the complication. Complication here is vasospasm, and drug is nimodipine. Very important. Mark my words. Okay. Subarachnoid hemorrhage में इतना ही याद करना है. You should be able to pick out the lesions. Okay. इसमें पकड़ना है. Now coming to epidural hemorrhage. Every time the case will be like bike accident. Okay, bike accident का case होगा. Now how to confirm that the patient question is asking you about epidural hematoma? Lucid interval. Now what is lucid interval? Waning and waxing of consciousness. Okay, waning waxing means patient is conscious, he became unconscious. Again he become conscious, again unconscious. So this is what known as lucid interval. If explanation like this is given in the question, your answer is epidural hematoma. Alright, let's see what are the important information are there. Rupture of middle meningeal artery, that is the branch of maxillary artery. This is very important point. Okay. Another important point is it involves a terion. Terion is the thinnest area of lateral skull. Now, apart from this thinnest area of lateral skull, can anyone tell me what is the definition of terion? Anyone? Hmm? टेरियन की definition. What is the location? What is the landmark of टेरियन? कोई बता सकता है? Okay, I'll write it down for you. Landmark where frontal, occipital and temporal bone meet. That is what known as terion. Okay, एक बार ये definition Google पे देख लेना. Okay, I think one of the bone, I think I am wrong. Maybe I'm not wrong. तो एक बार Google पे देख लेना. Okay, terion का ये definition. So instead of terion, they might give you the location like this, landmark like this. Okay, so don't get confused. Lucid interval important, bike accident important, terion important, image important. Done. Okay, done. Another thing is you can use it not crossing shooter line. Shooter line cross नहीं करेगा. Okay. Coming to subdural hematoma. Now in subdural hematoma, rupture of breathing vein. Breathing vein is important. यहाँ पे भी they can give you accident. Okay. But see this image. It is crescent moon shape. Okay, crescent moon shape. And यहाँ पे it is something like this. Alright. So based on the images, you have to identify crescent shaped hemorrhage. That's it. Nothing else. One thing, there can be midline shift. In epidural, midline shift is not there. Now, what is midline shift? Now, see, this is the skull. Sorry, this is the brain. This is the midline. Okay. So, देख रहे हो आप ये पूरी cavity shift हो रही है. Okay. Because of this force, it has shifted. That is what known as midline shift. Okay. In epidural, there won't be midline shift. All right. That's it. We are done with the hemorrhages. One last type, intraparenchymal. So with intraparenchymal, the most common etiology they will give you is systemic hypertension. Okay, most common. Okay, also seen with amyloid arteriovenous malformation. This word arteriovenous malformation, very important. How? I'll show you later. Okay, so hypertensive hemorrhage, Charcot Bouchard microaneurysm, very important. And as I made you write it down before, Basal ganglia is the most common location for intraparenchymal hemorrhage. Basal ganglia. Okay. Now see, coming back to this term, arteriovenous malformation. Okay. ऐसा पूछा है. Now in the NBME they gave one image. Long-standing history of seizures. Following features represent sir what? If you find something like this in the brain, your answer will be AV malformation. Okay, CG appearing brain. Okay, AV malformation मत भूलना. NBME का सवाल है, and I think you will also has one. And to my surprise, I got this question in the exam also. Okay, AV malformation. This is the image. Remember it. All right. And apart from this, I wanted to tell you one another point. It is not related to the topic, but I want to tell you. Yeah. Now, sometimes what happen is how they are going to confuse you is they will give you the case. Now, tell me one thing. Okay, I am asking you the question. Tell me the answer. Uh, सब symptoms हो गए. Now, I am asking you. Uh, on examining the patient, his tongue was deviated towards left. Okay, tongue was deviated towards left. Now, my question to you. Lesion यहाँ पे होगा या यहाँ पे होगा या यहाँ पे होगा या यहाँ पे होगा. And this is right, this is left. Similarly here, right, left, A, B, B. I am saying tongue was deviated towards left. Now tell me इसमें लीजन A पे होगा, राइट A पे होगा, लेफ्ट A पे होगा, राइट B या लेफ्ट. एनीवन?
लेफ्ट साइड होगा एंड
किसमें होगा?
ए लेफ्ट साइड होगा because
लेफ्ट.
tongue deviates towards the lesion.
ओके ओके. एंड मीडियल और लैटरल?
Lateral because face is controlled by lateral in the hormone, if that makes sense.
No, no. Don't mix the concept. Don't mix the concept. फेस वाला नहीं, आपको क्रेनियल नर्व्स के हिसाब से देखना है. क्रेनियल नर्व्स के हिसाब से लैटरल होगा. टेल मी व्हाट नाउ कंट्रोल टंग.
Hypoglossal.
हाइपोग्लॉसल का नंबर क्या है? कम ऑन. हाइपोग्लॉसल का नंबर क्या है? एनीवन?
12.
12. Is 12 is a factor of 12?
Yeah,
So it is a medial.
medial. Okay,
Okay.
so A.
Don't.
Hmm.
Yeah. So it is left A. Okay. This is another general rule. Cranial nerve lesions are always ipsilateral. Okay. राइट साइड का सिम्टम दिख रहा है तो प्रॉब्लम हैज टू अकर इन द राइट साइड ऑफ द क्रेनियल नर्व. ओके. सो यहाँ पे लेफ्ट था, सो द प्रॉब्लम विल बी इन द लेफ्ट. नाउ आई टोल्ड यू फ्रॉम दैट टेबल 4 के 12 के फैक्टर्स देखो. इफ 3, 4, 6, 12, these are supposed to cause medial lesion. Okay, these are present in the medial. Why they are causing in the medial lesions? Because when you study the brainstem in detail na, so nucleus, brainstem nucleus are present. So some nucleus are in the medial and some are in the lateral part. Okay, so this is the reason कि medial में होता है, lateral में होता है. That is about. Okay, so don't mix कि homunculus के हिसाब से ऐसे होगा नहीं. होमनकुलस के हिसाब से पूछना होगा तो वो ACA MCA एंट्रियर सर्कुलेशन हो गया. बट इफ cranial nerves come into play, you have to follow that rule, factor 12 का rule. Okay.
Okay.
So all right, so this concept is clear. तो ये मुझे बताना था. Yeah, sometimes what was my point of showing this image was don't get confused कि ये image में मैं कुछ identify नहीं कर पा रहा हूँ. Don't get confused. I am not able to identify anything over here. They will ask you कि A and B, they will ask you, you have to apply your brain. A is in the medial side, B is in the lateral side. Okay, and instead of AB they will give you ABCD, right or left का change कर देंगे. Okay, so don't get confused. Just think about medial, lateral. Look at the cranial nerve symptom. You are good to go. Okay, I hope this is clear. Now another point I wanted to let you know is, uh, yeah, if you get the image like this, okay, now see the problem is over here. This is the infarct. Okay, so now what is happening? This is the left side infarct. You won't be knowing this. I am writing it down for you. So if it is something like this, so there will be spastic paralysis on right. It is contralateral. Okay, and this region is crus cerebri. Okay, so this is crus cerebri. And अगर ऐसा image आया and or in the question they say there is an infarct of crus cerebri, you should be knowing that there will be contralateral spastic paralysis. All right. So this is some of the one liners which are not covered by BNB, not covered by UL, but they have asked in NBME. All right. So with this we are done with hemorrhages also. Ignore, ignore. Yeah. Diffuse axonal injury. Remember the image. ऐसी छोटी diffuse axonal injury होगी. Now how it occurs is usually by the accident or trauma. Okay. And MRI shows multiple punctuate hemorrhage. So ये image आपको दिखाएंगे वो. Okay, or this line they will use. All right. So diffuse axonal injury is important. Coming to aphasia. Okay. Coming to aphasia. Now, most probably they will focus on Broca and Wernicke only. Okay. Most commonly they will focus on Broca and Wernicke only. Broca में क्या होता है and Wernicke में क्या होता है? So Wernicke में he will able to speak fluently, but दिमाग काम नहीं कर रहा है. He don't know what is the he wants to say. Okay. The comprehension, the intellectual power is gone. Okay, whereas in Broca, he knows what he wants to say, he understands what he wants to say, but influent, he is not fluent. Okay, so don't confuse with the Broca and Wernicke. All right, so most commonly they will ask you Broca and Wernicke only, nothing they will ask. Now conduction can be caused by damage to arcuate fasciculitis. Now, when you saw the cerebral cortex image, the diagram, you saw there was one part known as arcuate fasciculitis. Okay, so if they ask you about the defect in arcuate fasciculitis, your answer will be conduct, and global may both are affected. So now go back to UL when you solve a question of Broca and Wernicke, and in the options you find conduction and global. उसका लिख लो, नोट बना लेना, because they have given the symptoms over there. I don't have the symptoms written with me right now, so I would highly recommend you कि at least symptoms लिख के रखो. Most probably they won't be asking about conduction global, they will focus on Broca and Wernicke only at step 1 level. Okay, so don't worry about it. नहीं मिल रहा वो क्वेश्चन, जाने दो. Broca and Wernicke are enough. Okay, moving ahead. Aneurysm. Yeah, this is important. Aneurysm is important. Look at this image. One image is there, easy to identify. Now, what is aneurysm? Abnormal dilation of artery due to weakening of vessel wall. Now, two types of aneurysm, secular and Charcot-Bouchard. First, berry aneurysm occurs at bifurcation in the circle of village. Bifurcation. Okay, so bifurcation, there are three bifurcations: anterior communicating, MCA पे, and posterior communicating. Anterior communicating पे bifurcation, posterior communicating पे bifurcation. MCA में क्यों? There is a bifurcation between the internal carotid artery and MCA. Actually, MCA is a branch of ICA, but वो ऐसा bifurcate जैसा दिखता है ना. That's why at there also this problem can occur. Okay, so let's just see what you need to remember over here is most common site. Most common site you need to remember ACOM and ACA. Okay, ACOM and ACA you have to remember associated with ADPKD, Ehlers-Danlos. ADPKD, when we were discussing the renal pathology, I told you ADPKD आपको याद रखनी है. It is very important. Berry okay. And clinically silent until rupture. Subarachnoid hemorrhage के साथ भी दिखता है. And yeah, so three things you need to remember. Berry then it is similar to saccular aneurysm. It can occur with subarachnoid hemorrhage. It can occur with ADPKD, and the most common location is anterior communicating and ACA. This is 3 points. Now coming to how they will ask this question is, instead of giving the blockage or instead of giving this disease, how they will ask is, if anterior communicating is compressed, there will be bitemporal hemianopia, compression of optic chiasma. Okay, we'll do this in the optal part, but now bitemporal hemianopia. Okay, so bitemporal hemianopia is a disorder of optic chiasma, but one of the reasons that is causing is this aneurysm. Okay, so you have to keep this in mind. ये याद करते जाना. Okay, MCA rupture. तो इसी में आएगा MCA distribution. MCA distribution हो गया तो face and upper limb का problem. So aneurysm can be one of the risk factor. Posterior communicating. Third cranial palsy. Third nerve cranial palsy. Okay. Third nerve cranial palsy हो रही है. So posterior communicating आप सोचोगे. But why this is occurring? You should keep the saccular aneurysm as a risk factor. Okay. So this is the reason why it becomes important, because all of a sudden you must be knowing what is it causing. What are the symptoms? You must be knowing that. But you forget कि aneurysm की वजह से भी compression हो सकता है. Okay. So this is important. Coming to Charcot-Boucher microaneurysm associated with hypertension. So ये mostly हमने देखा intraparenchymal hemorrhage. Okay, it is given here. Intraparenchymal hemorrhage. Okay, not visible on angiography, but saccular is visible on angiography. So make this very clear. अगर intraparenchymal hemorrhage आ रहा है और instead of intraparenchymal hemorrhage, they will give you basal ganglia. Sorry, not basal. Yeah, basal ganglia only. Or instead of basal ganglia, they will give you what they will give you? Caudate, or they can give you putamen. Okay, these are parts of basal ganglia, right? So anything they can give you. Think about intraparenchymal hemorrhage and Charcot-Boucher aneurysm as one of the cause of intraparenchymal hemorrhage. I hope this is clear. Questions will be there. All right. Fever versus heat stroke. Actually तो आया नहीं है, but in UL they have asked. तो temperature देख लो, mechanism देख लो. That's it. Treatment देख लो, पूरा ही देख लो क्या बचा है. Okay. UL one question was there. No question in NBME. No question in exam. Okay. Moving ahead. Seizures. Now, seizures, if you go in general, not high yield. For step one point of view, not high yield. What is high yield is anti-epileptic drug. Anti-epileptic drug is very important, and how it becomes important, and if you want to study the anti-epileptic drugs, you should be knowing which seizure is occurring. So indirectly, you have to just give a read. If a patient is showing this symptom, this is the seizure going on. If this symptom, this is the seizure going on. Okay. So बस आप इतना याद रख लेना ये and ये. Okay. Based on that, we will cover this in the anti-epileptic drug. Okay. Because anti-epileptic drugs are very highly. Okay. Most commonly they like to ask over here is absence seizure. Most commonly they love to ask is absence seizures, and in this they will give the case of a child plus staring, and after staring there is a continuous blinking. Okay, so पहले तो वो अपनी दुनिया में खो जाएगा, फिर अचानक से there will be blinking. Okay, that is what absence seizures, and the treatment for absence seizures is etoxaquimide. So just remember this information over here, so that while doing seizures you keep this at the back of your mind. Okay, baki even if we go for anti-epileptic medications now, in then they actually give the myoclonic seizure hai, tonic-clonic seizure hai, absence seizure, they definitely give. So that's why we don't need to waste our time on seizures. छोड़ दो seizures का part, step 1 के point में नहीं आएगा. All right. Headaches, and this is the last topic for today's discussion. From tomorrow we will be discussing movement disorders. Okay, so headache देख लेते हैं क्या है. Headaches I consider as a very high yield. Okay, very highly. Now, cluster, migraine, tension, trigeminal neuralgia, and another one you're forgetting is giant cell temporal arteritis. Okay, तो एक सिंपल सा फंडा दिखा देता हूँ. If there is eye involvement, cluster is the answer. Eye involvement, retroorbital pain है, cluster is the answer. If eye involvement भी है, the patient, sorry, there will be no eye involvement, particularly retroorbital pain नहीं होगा, but along with the headache, patient is having vomiting, nausea, or some kind of aura, or in the case they will say कि light on करने से, if the light is on, more pain. Okay, if they give all these symptoms, migraine. And tension, in the tension, that is a stress headache. And the most common type of case they want to ask is so much workload in office. See, I've already written here. Employer working in office headache. Okay, so much workload in office, उसकी वजह से there will be a continuous pain. Okay, continuous pain होगा, that is tension headache. If it is one sided pain, vomiting, nausea, that is migraine. And cluster, retroorbital pain, eye की जगह pain हो रहा है, that is cluster. Is that clear? These are the distinguishes. Now, important points. Coming to the important point. They love to ask so many important points. Let's just see. Time. Time is important. Okay. Second, unilateral, and bilateral. Third, in cluster, there can be honor syndrome also. Another one, there can be autonomic symptoms also. Autonomic means lacrimation or rhinorrhea. Okay. So they will give you this. Okay. Now treatment यहाँ पे सबसे पहले 100% O2 will be the first treatment. After then you go for verapamil. Verapamil is to prevent another episode. Okay, बार बार होने से बचने के लिए you will give verapamil, but the first treatment will be 100% oxygen. All right. So that's all for cluster. Coming to migraine. Now migraine is there. If you study medicine, in medicine there are three theories that they have proposed, but we don't need to go into detail there. Let's just see over here. Photophobia, nausea, and phonophobia. Aura. Now irritation of cranial nerve, trigeminal nerve. 5. Okay. Release of vasoactive neuropeptide, example substance P, calcitonin related peptide. Now in UVL and NBME they have given this substance P. Okay, so release of substance P or calcitonin related peptide, this become very important. Okay, ऐसा दिया है. So migraine treatment में you will first tell the lifestyle changes and then you will give all this drug. They don't ask treatment for migraine. They don't ask treatment for migraine because it is little complicated. Okay, coming to tension, band like pain, nothing else. No aura, no photophobia, no phonophobia. Okay, analgesic, NSAID and all those stuff. So these are the three major types of headache that you need to be aware about. Coming to another type, that is trigeminal neuralgia. In trigeminal neuralgia, what they will give, either they will give you a case of brushing and they will give you a case of eating. And there will be extreme shock like pain. Okay, you see shock like pain in the distribution of cranial five, chewing, talking, touching parts. Okay, last for seconds to minutes or increase in intensity and frequency over time. First line is carbamazepine. Carbamazepine is very important. They've asked carbamazepine. So trigeminal neuralgia का treatment carbamazepine. Okay, you have to pick out trigeminal neuralgia है कि नहीं. Easily identifiable. Okay. Now moving on to the giant cell temporal arteritis. We will be doing this in CVS along with vasculitis. Okay. Giant cell temporal arteritis के साथ बहुत सारी चीजें आती है. There will be decrease in vision. There will be increase in ESR. All those stuff. Okay. So giant cell temporal arteritis का अलग केस है. Treatment for that is steroid. Okay. So you need to be aware about these 5 types of pain: cluster, migraine, tension, trigeminal neuralgia, and giant cell temporal arteritis. Okay. So let's just end here today. I am tired. From tomorrow, we will do movement disorders and all the remaining part of neuro. We will finish tomorrow. Okay. So on Monday, we will be doing CBS. I'll try to finish CBS in one day only because it is not big system. It seems big system. Okay. And थोड़ा बहुत रह गया तो Tuesday को cover up कर लेंगे. And on Tuesday and Wednesday, we will do reproductive. So by Wednesday, I'll be finishing the course. Okay, the class is over. If you have any doubt, uh, let me know. I will end this meeting and WhatsApp call you. And if you want to talk to me personally regarding the preparation or anything, let me know. I'll WhatsApp call you. The class is over. You can leave.
Thank you.
No worries. So Sharon, I hope the class was good. Benefit हुआ कुछ?
Yeah, yeah, it did
पक्का
benefit
ना?
a lot of things. Yeah, Paka,
Okay.
especially that
No.
nerve thing. I usually get confused, and that was like my weak point. And I thought it's okay to tell you. I felt comfortable. I did tell you, and then you cleared it out. Now I'm very clear about it.
Okay, so you are clear, right? कोई doubt नहीं है, right? सब clear
Yeah,
हो गया?
nine. Huh.
Alright, alright. So
Okay.
recording अगर
Thank.
आपको चाहिए तो मैं recording कल भेज दूंगा morning में. अभी तो upload होने में time लगेगा. और images I'll share in the
Okay.
group. And apart from this, अगर आपको कोई problem आ रही है, just leave me a text. Okay?
Thank you.
Okay, now bye bye.
Bye.